Did you know, on average, every 40 seconds, someone in the United States has a stroke? Of these, about 87% are ischemic strokes caused by a clot blocking a vessel that supplies blood to the brain. In many cases, there are effective treatments that reduce or eliminate the brain damage caused by acute ischemic strokes if treatment is provided fast enough. This educational presentation will provide an overview of an upcoming EMS and ED collaborative process improvement study, bridging the gap of communication between emergency medical personnel and emergency department providers in patients with stroke symptoms. It is designed for ED personnel at St. Mary Mercy Hospital and EMS personnel of Canton Fire Department and Northfield Township Fire and Rescue, the two EMS agencies participating in the project. The study will measure the effectiveness of using an EMS pre-hospital stroke checklist for recording stroke symptoms. Research shows that those who sustain a stroke are more likely to have improved outcomes and fewer complications if hospitals use standardized care processes. Key components to stroke care include initial assessment, notification by EMS personnel, and transfer of care with optimum handover. The primary aim of the study is to explore whether a pre-hospital stroke checklist will improve communication of stroke symptoms between EMS providers and ED personnel in an organized approach. It is expected to answer several important questions. First, will the use of a pre-hospital stroke checklist arranged from 1 to 10 administered by both EMS agencies improve communication of stroke symptoms in an organized, standardized approach, both before and after EMS arrival, compared to all other EMS agencies? Second, will the use of a timeout initiated during EMS report to ED staff upon their arrival using the pre-hospital stroke checklist reduce repetition of information previously reported on radio call, thus standardizing handoff and also improving satisfaction between EMS and ED personnel? In addition, will reported and recorded symptoms include balance and eye deficits if present? And will the improvement of communication of stroke symptoms improve workflow and timeliness of patient care? Retrospective data was collected prior to the startup of this project. The data collection was of 101 radio logs from ED Radio Logbook of patients brought to the ER with stroke symptoms between the dates of February 2nd and September 7th, 2017. The data collected were the top 10 criteria requested by ED physicians, which will be discussed more in depth. The log reports were separated into 3 groups: Northfield Township Fire and Rescue, Canton Fire Department, and any or all other EMS, which is the control group, not utilizing the checklist. Out of 101 stroke symptom entries, nearly 13% were called in by Northville, nearly 23% were called in by Canton, and the other 64% were called in by other agencies. The results of analyzing the pre-study data showed there was a variation in symptoms reported. A number of key symptoms to determine stroke treatment, such as last known time normal, blood sugar, current use of anticoagulant or antiplatelet therapy, neurodeficits, were absent on the EMS log. However, it must be noted that it could not be determined if the symptoms were reported by EMS and simply not entered in the log by ED staff. This project will provide benefits to ED staff and EMS personnel, as well as stroke patients, by improving the transfer and reducing repetition of information through the implementation of a stroke checklist. ED personnel will be better prepared to facilitate timely care for stroke patients. Stroke care is very time sensitive. Every minute can make a difference in patient functionality and recovery. An educational grant award was received by the Michigan Ongoing Stroke Registry to accelerate the improvement of care, to partner with EMS to improve stroke care. The summer educational sessions that were provided to EMS to raise awareness and importance of communicating data clearly and concisely included the BFAST diagnostic, stroke recognition, treatment including blood pressure management, inclusion and exclusion criteria for alteplase therapy, and large vessel occlusion strokes. In addition to the Cincinnati Pre-Hospital Stroke Scale, EMS will report and record on the checklist B for balance and eyes in the BFAST acronym, as shown on screen. The ED staff responsibilities will include ensuring radio symptoms documented in the radio log are also transcribed onto the checklist, understanding the process flow, the step-by-step procedure from EMS calling in on the radio to arriving with the patient, administering the timeout, time to deliberate with EMS and receive information 6B through 10 on the checklist. Completing post-handoff. Both ED and EMS checklists will be combined, ensuring all information is accounted for and easily accessible. Shown on screen is a process flow of the steps from radio call to the collection of checklist data. Upon EMS radio call, the ED will identify if the agency is either Canton or Northville. If so, the ED staff will transcribe information in the radio logbook per normal procedure, and will also transcribe the information to the pink checklist. This checklist will be attached to the pink clipboard and given to the assigned ED provider waiting for EMS arrival. EMS will arrive with the information transcribed on the identical checklist with 6B through 10 and any other pertinent information. Upon EMS arrival, a timeout will be given, and they will report 6B through 10 and any other information to the ED staff. If the patient presents with a compromise in the primary survey, ABC, airway, breathing, or circulation, they will be immediately transported to the trauma room. If the ABCs are not compromised, the patient will be taken to CT scan and stroke treatment will proceed as normal. The EMS and ED stroke checklists will be merged together on the pink clipboard. The ED staff will follow normal protocol for all other EMS agencies. The checklist will not be used. Shown on screen is the layout of the pre-hospital checklist or ED-EMS stroke handoff form. These will be distributed in the emergency department for staff to populate, as well as to Canton and Northville EMS agencies. On screen are the specific parts of the checklist that contain the criteria that should be reported to ED staff by EMS en route to the hospital. ED staff will record this information in the radio logbook as well as transcribe the information to the checklist. These criteria include last known time normal, time of discovery, vital signs such as blood pressure, heart rate, and respiratory rate, blood sugar, current use of antiplatelet or anticoagulant, and the time the dose was last given if applicable. The list located to the right of the radio symptom box will help for quick identification of one of these drugs and whether it is an anticoagulant or antiplatelet. Baseline mental status, orientation to person, place, time, and situation are also to be recorded. Neurological deficits will be recorded in the neurological symptoms section. On screen are the other areas of the checklist that will be completed by EMS en route to the hospital. Upon arrival, the ED staff will record the timeout on arrival, located underneath the radio symptoms box. During the timeout, EMS will report their transcribed information 6B through 10, baseline function, medical and surgical history, which is listed in the box titled Absolute Contradictions to TPA, located on the back of the checklist. The code status if known, either full or DNAR. They will also report if it is known whether or not the patient's family is en route and any other pertinent information. Shown on screen is the ED checklist that will be used to transcribe EMS Standardized Report 1 through 6A. This information will also need to be transcribed on the HEMS radio log. The ED checklist will be placed on a pink clipboard and given to the ED physician with report of patient symptoms and estimated time of arrival. The ED physician will await EMS arrival with the checklist and record 6B through 10 on this checklist when EMS arrives.